Hi, this is Dr. Kant Shah here, pediatric, robotic and laparoscopic surgeon. So as a pediatric surgeon, we operate right from the newborn baby who may be 1 or 2 hours old to up to 18 years of age, and sometimes even older children if they have congenital anomalies. I like spreading information about surgical problems that occur in children, and I've also got my own hospital called Borivali Healthcare, where we have state-of-the-art facilities for 3D, 4K laparoscopic surgery in children, again right from newborn to teenagers. And we have got a state-of-the-art ICU for all adults, children and newborn babies also. So you may have already watched some of my videos, but in this video we are going to talk about 5 or 10 common surgical problems that affect children. The first one is inguinal hernia. This is very common and is one of the commonest surgeries I do. So what is inguinal hernia? It's when some part of intestine or omentum in an older child, or in a girl it could be the ovary, which goes down the inguinal canal and towards the groin area. That is called an inguinal hernia. This happens because that part is supposed to close automatically when the child has developed to full 9 months of age in the fetal life. But for some reason that it has remained open, and as the child grows older and strains, that canal opens up and it causes a hernia. Now in children, almost 30%, especially premature babies, may have that canal open on both sides. So in children, we strongly have started recommending laparoscopic surgery for the last 10 years. And we found a lot of children have an open canal on the other side. And if we don't tackle that, many do come back later with another hernia on the other side. So in children, we do recommend laparoscopic surgery for inguinal hernia. When to do the surgery? Well, if that piece of intestine or ovary or omentum gets stuck, it can cause problem to that particular organ, or in a boy it can even cause damage to the testes by restricting his blood supply. So there is no point taking such a risk. Whenever you see a child with inguinal hernia, that child needs surgery as soon as possible, usually within 1 or 2 weeks. And even in those 2 weeks, that parents should know the signs of obstruction, because almost 30% children will have obstruction at some point or the other if you leave them and don't operate on them. The next common condition that I deal with as a pediatric surgeon is undescended testes. What is it? Well, the testis is actually made inside the abdomen near the kidney in the fetal life, and this descends down slowly via the groin and into the scrotum, and that happens usually by 7th to 9th month of the fetal life. So if it has not happened, it still may happen for the first 3-4 months of life, and hence we wait and observe until then. But by 6 months, if the testis is not descended down into the scrotum, then that child needs surgery. If the testis is palpable, straightforward open surgery. If the testis is not palpable by the pediatric surgeon, then it's a laparoscopic surgery where we may not find the testis. We may find a very small testis. Or if there is a good testis, it may have enough length to come down in one step, or it may take 2 steps to come down. So in summary, a child with undescended testis needs surgery at 6 months of life, and the surgery may be laparoscopic if the testis is not palpable by the pediatric surgeon. The next condition that we will talk about is phimosis. Phimosis means the foreskin, the skin on the head of the penis, is closed. Now, many people are not aware that in 100% of the boys, it will be closed at birth unless they have a problem in that area like a hypospadias or something. So in 100% boys, this foreskin will be closed, and it's meant to open gradually over a period of a few years. And unless there are problems like scarring, where you are getting infections and bad scarring, most of these children don't need surgery. By 3-4 years, some of them may need gentle rotational massages or small stretching exercises, and gentle stretching exercises by which we may be able to open the prepuce completely. And sometimes we may use steroid ointments to help that process, usually after 5-6 years of age. But most of these children do not need surgery for the phimosis. So when do we actually do surgery, which is called circumcision? A, for religious purposes, that is the commonest. B, if there are infections happening in the prepuce, and C, if there is scarring which has happened on its own, called lichen sclerosis. If a child has a scarred white colored foreskin, then that child usually needs surgery called circumcision. Okay, the next condition that we will talk about is hydrocele. Hydrocele means collection of fluid around the testis in a boy. This fluid comes down the same passage that we talked about as the inguinal hernia. If that passage is very tiny, then of course intestine can't come down that route, but fluid will come down. But because this passage is tiny, it may close on its own, and hence in a case of hydrocele, we would wait for 12 to 15 months of age, and by that time, if it has not closed and there is fluid accumulation, the child will need surgery. The surgery can be done both by open or laparoscopic method. So we've got fair number of conditions to cover, as we said. So we are going to make this video in 2 parts. This is the first part. Please watch out for part 2 as well. Thank you for watching.